Hello and welcome to our discussion on a very important topic, the role of pharmacies in our health. When you think of a pharmacy, what comes to mind? For many, it's simply a place to buy medicines. But a community pharmacy is much more than a shop. It's a health hub in your neighborhood. It's the most accessible part of the healthcare system. The pharmacist is a trained professional. They should do more than hand over a packet of pills. Their job is to ensure you get the right medicine. Their job is to help you understand how to take it correctly. Their job is to make you aware of potential side effects. This makes the pharmacy a crucial first point of contact. The idea is built on trust and accessibility. Have a minor cough or cold. You can visit your local pharmacist instead of waiting for a doctor's appointment. They can advise on over-the-counter remedies and help decide if you need to see a doctor. That's the fundamental purpose of a community pharmacy. It serves the local population by dispensing prescriptions and by offering professional health advice. This reduces the burden on hospitals and clinics, making healthcare more efficient for everyone. The pharmacist is knowledgeable and approachable. Now, let's look at the situation in our own country, India. Indian pharmacies are everywhere. Bustling city streets, small remote villages. They are an essential lifeline for millions of people. For many, the local chemist shop is the first and sometimes the only place to seek help for health issues. This incredible accessibility is one of the greatest strengths of our system. You can find a pharmacy within a short distance in almost any part of the country. This network ensures that essential medicines are widely available to a vast population. These pharmacies play a crucial role in our healthcare landscape. However, the practice of community pharmacy in India is very different from the ideal model. Most pharmacies, which we often call chemist shops, primarily function as retail stores. Their main job is to sell medicines. The person behind the counter may or may not be a qualified pharmacist. Often the role is limited to reading a doctor's prescription, dispensing the corresponding drugs from the shelf. There is very little patient counseling involved. How to take the medicine, what foods to avoid, what side effects to watch for. These topics are rarely discussed. The focus is on the transaction of selling the product rather than providing a healthcare service. One of the biggest challenges is the lack of strict regulation and enforcement. While a pharmacist's license is required to operate a pharmacy, the qualified professional is often not present. Let's now turn our attention to developed countries, United States, United Kingdom. Here, the concept of community pharmacy is far more advanced and integrated into the healthcare system. The pharmacist is not just a dispenser of medicines, they are recognized and respected as a vital healthcare professional. They are an active partner in patient care. When a doctor writes a prescription, the pharmacist does more than just fill it. They review the patient's medication history to check for potential drug interactions, allergies, incorrect dosages. This crucial safety check prevents many medication-related problems before they can happen. In these countries, pharmacists offer a wide range of clinical services. For instance, many pharmacies run medication therapy management programs. Pharmacists work directly with patients who have chronic conditions, diabetes, asthma, heart disease. They help patients understand their illness, manage their multiple medications, and monitor their progress. They teach patients how to use devices like insulin pens, inhalers correctly. This ongoing support empowers patients to take better control of their health, leading to improved outcomes and a better quality of life. The pharmacy becomes a center for chronic disease management. Furthermore, pharmacies in the UK and USA are key centers for public health initiatives. You can walk into a local pharmacy to get your annual flu shot pneumonia vaccine. They also offer health screening services, blood pressure check. The role is supported by strong regulations, a robust educational framework. Comparing the Indian system with the Western model reveals a significant gap, but it also shows us a clear path forward. The key difference lies in the role of the pharmacist. In India, the role is largely passive and commercial, focused on sales. In the West, it is active and clinical, focused on patient care. To improve, India must empower its pharmacists. We need to transition them from being simple dispensers of medicine to becoming genuine healthcare counselors. This requires a fundamental shift in mindset, policy education. Our pharmacists are a vast, underutilized resource with the potential to transform public health. The first step is to strengthen our regulations and ensure their strict enforcement. A qualified pharmacist must be present at all times in a pharmacy. Put an end to selling prescription-only medicines without a valid prescription. Technology can help here. A digitized system for prescriptions could link doctors, patients, pharmacies. This would create a transparent and accountable chain, making it impossible to dispense powerful drugs irresponsibly. Next, enhance the education and training of our pharmacists. Update the pharmacy curriculum to include more clinical skills, patient counseling techniques, managing chronic diseases. Introduce pharmacist clinicians, authorized to provide basic health screenings, vaccinations, medication management services. Make the pharmacy profession more attractive and respected. Encourage talent to stay and serve the community.